So it will take the shape of a lemon. It is out, there must be a fracture, usually. Usually there is fracture. And this one, the banana, is subdural. So what is this, Hassan?
Subdural.
And what is this?
Epidural.
Epidural. These are the fissures in the cistern where you can find the subarachnoid hemorrhage. Okay? Now, if there is a lemon or a banana, this is extra and subdural. And when there is a blood which is distributed along the cistern and the fissures, this is most probably the subarachnoid. So what is this? Subarachnoid hemorrhage. You see, it will be like this. And usually the subarachnoid hemorrhage is the area of debate between the medical and surgical, the neurosurgeon and the medical. A fight. Is yours? No, it is yours. It's not mine. Why? Because why? What do you think? Why? There's usually a fight between the two on a patient. Of course, not in the private. In the private, they will fight for the patient. Why? Fathi, what do you think? Why? The neurosurgeon and the internal medicine fight if the patient presented to them with subarachnoid hemorrhage, so they will not, it will not straightforward go to the one of them. Why?
Well, doctor, shouldn't it go to the neurosurgeon?
Neurosurgeon? What do you think? Why they will not, it is not mine, it is yours.
Maybe
because
it can be related to
hypertension. And if there's straining, it can rupture, so it's medical.
Why not because the neurosurgeon will not do a surgery for this one. Due to it is inside and due to the rupture of aneurysm, so usually they will not come, they will not do a surgery for them usually. It's not an extradural or subdural that he can drain it. The subarachnoid usually due to rupture of one of the aneurysms. You can see here, it will rupture and it will be, so you see this is the aneurysm. So usually it is conservative treatment. So the surgeon will not do a thing. The subarachnoid. This is the subarachnoid hemorrhage, as we said, most probably it is related to aneurysm, probably it is congenital malformation, or sometimes something called hypoxic ischemic encephalopathy. So let us, what is this Afia?
subdural hematoma.
Huh?
Subdural.
Subdural. Why? Because it is
Banana shape.
banana shape. And what else we said? So it is like that. The subdural hematoma, as we said, there is a bridging veins. It is associated with, but not that much of trauma, 10 to 20. Usually old, and it happens even in the children. The problem in the subarachnoid, there is acute and chronic, and sometimes it will happen and nobody noticed it, and after a while, it will be a late presentation, they will discover that there is a subarachnoid hemorrhage, because usually it is not associated with trauma, 10 to 20, and there is no fracture. So what is this? Anybody can describe this for me? Fathi, Kauthar.
This is a CT scan.
CT scan of the brain?
It is sagittal.
Sagittal?
No, transverse.
Transverse of axial. CT scan of the brain. By the way, CT scan of the brain, we have usually two things. One of them, two windows. One of them they call it bony window, so that you can see the bone, and the other one is the brain window. And we can have it like other CTs. Sagittal, we can have it coronal, and we can have it axial. So this is axial. And we can have it like the other CT scan. With contrast or without. So this one with or without? Without. Yeah. The hemorrhage at the beginning, it will be hyperdense. By the way, the last time I put an MCQ for the year 3, I showed them an plain X-ray, and there is an area, wide area. What is the differential diagnosis? They send an objection because I put an option, radio opaque, and one I write radio dense. They said, yeah, they are the same. We said always, the density is a criteria for the CT scan. Good? Okay. So this one, the bleeding, the acute bleeding is radio dense at the beginning. Yes.
So doctor, how do you differentiate between it and the contrast?
I mean, you cannot see other blood vessels. There is no vessel. I know in the brain, but definitely you will ask for all the examination. You will see all the films. There will be no blood. And but I mean, usually any trauma will do it without contrast. Usually, unless other things. But to start with, we will do it, and we start always with CT scan. And in the CT scan, the acute bleeding will be hyperdense. The chronic will be black. So what else we can see here? So this is a CT scan of the brain, axial, without contrast, showing what you can, Kauthar, what you will describe this?
Banana
Yeah, but I mean, I mean, you can see that there is an area which is hyperdense area in the left side of the anterior part of the brain. But the other thing which is important here is this one. This black one. This one. Huh? No, not bleeding, but it means that the brain is atrophied usually. Okay? You see the brain is atrophied. So, and what else? There is an important thing is to look for the ventricles, because if there is a midline shift, this is a determinantal sign, bad sign, and we need to act. The neurosurgeon usually at home, what happened? So if there is midline shift, what? Immediately will come. Okay? I mean, sometimes, of course, they need to be evacuated, but not. So this is, what do you think? Kauthar? Subarachnoid, subdural, extradural?
It's subdural.
Subdural, because it's a banana shape.
Doctor, can you go back? Can you go back?
Yes.
The area where you said there's atrophy, can't it just be because of the point at which the image was taken? If it was taken higher up, it might not show this atrophy.
No. I mean, this area, because you see the sulci and the gyra of the brain, the black area, it comes, the black area, it means either CSF or the brain is atrophied. This is, the brain usually will cover all the area. And sometimes you cannot, this one, sometimes, I mean, it will be, sometimes it is not clear cut, either banana or by concave, which is the lemon-like. Yes. So sometimes you can say, what is the clue? There's fracture usually, with the fractures. Yeah.
Doctor, what if it's the chronic bleeding you said?
And this one, no, not nothing. I will show you another one. Okay. So this one is acute. So this is what sort of hemorrhage is this? This one, Anya?
Extradural.
Extradural. Why?
Skull fracture.
Okay, and you can see it is like biconcave. Okay, pushing the dura. Okay, there is no midline shift, and as you can see here. So, who can comment? Fathiyya.
So this is a brain CT scan, transverse view. No IV contrast.
Brain CT scan, no IV contrast, axial view.
Yeah.
Yeah.
There is a hyperdense area on the left.
On the left,
right side.
on the right side of the brain, there is a hyperdense area.
There is a midline shift.
So yes, it is very important. The midline shift is here. You see, this is very important here. You see the ventricles? Look at this ventricle. This is very important. Okay? So this one, it can come, I mean, I can say that this is subdural because it is banana-like, right?
Doctor,
But yes,
is that an epidural?
which one?
The one above the.
This one?
Yes.
Probably.
Is it active bleeding and the other? I mean.
Probably. You remember the previous one? Let me show you something. Look at the density. It is almost, I mean, we can have another one. No, we'll go too far.
arrow.
Huh?
The arrow on the left.
This one, you can see, yeah, I mean, a little bit homogeneous, right? But if we see ours, the last one, it is on the heterogeneous. This one different, not the same. So probably this one is not just acute. Acute only some changes, I mean, not on the spot, sometimes. But the first one probably it is, as I told you, probably it's CSF collection of fluid. But the most important thing is the deviation of the, yes. And here, again, Hassan.
This is a CT scan of the head showing a subdural hemorrhage with both acute and chronic bleeding.
And some midline shift.
And midline shift.
Yeah, okay. And if you can see the area here, you remember when you talk about the enhancement? I mean, the contrast is not taken by the brain completely. So here there is an area either of start of necrosis, okay? I mean, not the same like the rest. So probably it is a trauma, contusion, not concussion. This one, Hania.
CT of the brain, axial view, no contrast, with a hyperdense area on the left side of the
Oh,
side.
no, the same, left, right.
Left, okay.
So it is the right.
Right side.
Left, right.
Right.
Yes.
And
What is this?
on the left side, I think contusion as well. The left. I
No, I mean, no. Because sometimes in the views you cannot see the ventricle. But I mean, what is this? What do you think? What is the cause?
There's a hematoma, right?
So which hematoma is this?
The subdural.
Subdural, right? Subdural.
Epidural.
Epidural for more than one
It's long
purpose.
as well.
There is fracture here,
I
right?
can see that.
Fracture of the bone, and then you can see something called subgaleal hematoma. I mean, the bleeding out of the brain. Okay. This is what?
Subdural.
Again, but you see, subdural. No.
No midline.
Yeah, you can see the banana shape. Here, what is this, Hassan?
CT head. There are subgaleal hematomas, and there is a
No, this is normal, not subgaleal. There is intraventricular
Intraventricular.
hemorrhage, and there is area of non-enhancement, probably necrosis in the brain. You see, ischemia, areas of ischemia. Okay, Zaid, you can describe this? Huh? What is the blood here? In which area? What is this area? The ventricles, right? So, what is the bleeding, Yara? Here? Intraventricular hemorrhage. Bleeding in the ventricles. Remember that I showed you the lateral ventricle, the third, the fourth ventricle. Again, what is this? Intraventricular. So sometimes there is an aneurysm rupture and will cause this one. So this is, and you see, Zaid, this is the subdural hematoma, extradural hematoma, intracerebral hemorrhage. This is the most important area that we talk about, which is what?
The midline.
The afia. What is this?
Midline shift.
Shifting, midline shift. Again, you see the midline shift is very dangerous. Sign we see here, this is the midline and shifting to the side. What else you can find here, Afia?
There is a subdural.
Subdural hematoma, right? There's subdural hematoma, and probably some bleeding in the ventricle, right? And midline shift. I mean, this is why there is a midline shift, because there is a hematoma pushing the midline. Hassan, what is this?
There is subdural hematoma
Where is it?
on the right side of the picture.
On the right picture or on the left?
On the left picture, on the right side of it.
On the which side?
Right side of the picture, left side of the patient.
Right on the picture, left side of the patient.
Yes.
Left patient. This is the subdural
Yes,
hematoma.
and there is even between the
Extending
yes.
below, this is, you can extending down to the tontorium.
Mm.
Okay. And what is this one? What is here? What you can see here?
The same.
Hania.
Same thing, midline shift.
Sanjida. Okay, what else? She said midline shift. Sanjida, what else you can see here? Midline shift and No.
Also subdural hematoma.
Subdural hematoma, right? Subdural hematoma, which causing the hematoma.
Yeah, but he said subdural. That's it.
No, yeah, I was talking about this one. Subdural hematoma. Okay, what is this? Kauthar, what is this?
This is a CT scan of the brain, sagittal view, no IV contrast. There is a hyperdense lesion on the left side at the back, posteriorly in the brain.
With?
With the midline shift,
What is the diagnosis?
epidural hemorrhage.
Extradural epidural hemorrhage. The same, yes. Okay. Bembilla, Ahmed, what is this? Tell me.
CT scan of the brain, transverse view with without contrast, and there is a midline shift and epidural hematoma with a fracture of the head.
No. There is, and what else you can see? Look, this one is craniotomy. They remove the bone, and you can see some air here, right? Some air here around. Some shift midline. Probably they were treating this one, right? They were treating, so this is a borehole surgery to remove the extradural hematoma, right? Okay? Okay. So, what is this here? Again, this one, we said, this is the same. So, this is at the beginning, immediate post CT scan, complete evacuation of the, here delayed, the delayed cerebral atrophy. You remember when we talk about the atrophy? For instance, which one? See, let me show you. This one, the atrophy, they said about this one, which is almost the same.
And the ventricle is larger.
Huh?
And the
The
ventricle.
ventricle is larger, exactly. And here some areas, you see, the area, still the area of the surgery. This is the area of surgery. You can see here, there is some fluid. This is air, of course, this is fluid. I'll show you. So, again, here, surgery. This is sometimes contusion. We said concussion, contusion, bleeding. It will start like this, then it will enlarge when there is damage and bleeding in the material of the brain. Right? Again, here they did a craniotomy for the patient, and you can see the here the contusion, they will call it. Okay, see this. Of course, sometimes after a while. So progression of contusion within 2 hours or 6 hours. This one, after a while. Sometimes we need, when we notice that the patient is deteriorating, we need to do another CT scan for follow-up to see what happened. And in this case, there is bleeding which is increased in the material of the brain. The same here. Okay, so we said the hemorrhage here, normal CT scan here, the hemorrhage. I put this one, CT scan of the brain, intracerebral hemorrhage. This is where is this hemorrhage? In the ventricle? Afia? In the material of the brain. We also call it intracerebral. In the material, there's some bleeding. Okay? What you will do for this one? Surgery, right? Medical. We cannot do, we cannot operate on this case. There is something at the last, very important, they call it coup and counter coup. When we have a trauma, there will be, the brain will move in the cerebrospinal fluid, and there will be another trauma on the other side, secondary impact. You can see here the trauma. When there is a trauma, you see the brain impact, the brain will come, it is here, then it will have an impact, and then it will move. You see? It will move to the other direction. So you have here lesion and another lesion. So they will call it coup and counter coup, right? And you can see it here. So again, this is you see this is the trauma. We will have impact here, and then the brain, it will move, from one side to another side. Again, this is the coup and counter coup. You can see the one here and then another one here. Okay? What you can see here in this one, there is no, this one is normal. Where is the lesion? This is a part of the bone. Here is the lesion. Because there is, what is this? What you consider this, Yara? If there is
Epidural.
epidural, because there is fracture. This is what you call this one, Hassan? What do you call this?
The bone window.
Bone window. This is the bone window. This is the brain. Okay, honey, what is this?
Brain. The brain window.
Brain window.
Yeah. No.
It's MRI.
MRI. Okay. Again, why we do MRI when there is deterioration in the patient condition? So we do an MRI.
The first
Okay.
one is the.
This one is the brain window. This one is the bone window. You see the brain, there is a lesion. Okay? Here. This is the lesion. But after a while, we discover that you have another one. This is in the, we said MRI. All of this is MRI. This is the coup. This is the counter coup. Thank you. Okay. So we have 5 minutes, and then we'll go for the last lecture. And at 1:30, we'll